For anyone who has suffered from back pain, in many cases it can be debilitating, and often it forces you to alter your lifestyle altogether. You can't always do the things that you want to when you suffer from severe back pain, and that's exactly why we wanted to address this very issue. We invited the professionals from Arizona Pain to join us in Your Life Arizona to talk about solutions. Dr. Eric Church is here this morning, and you and I have had a fascinating conversation before this segment, so thank you so much for coming on our show this morning to talk about this. You know, in a second, you guys use a technology, a cutting-edge technology called Intracept Procedure, and I'll get to that in just a second. But for everybody who's watching at home, what kind of patient do you see? If somebody's at home watching and they're suffering, at what point do they say, you know what, I need to contact somebody like Dr. Church?
Well, many of the patients that we see are patients who have pain, and you know, it's affecting their quality of life, and they've started to restrict their activities, not doing things that they want to do, and they come to us to try to get their lives back.
Yeah, and a lot of people, I imagine, are in a desperate spot.
Oh, absolutely. We give hope to a lot of people, and that's our main goal.
And you know, we were also talking about it's not just hope, but you are literally giving people their lives back.
Yeah, will we try?
Yeah. You know, the other thing too I thought was really fascinating about our conversation earlier was you give people an option that does not include opioids. And people don't a lot of times want to be on drugs because they're concerned about addiction, right?
Absolutely. The opioid crisis has been in the news over the past decade, and so people are seeking alternatives.
Okay. There's something called, and you're going to have to forgive me, help me with the pronunciation here, vertebrogenic pain?
Vertebrogenic pain.
Thank you very much. What is that exactly?
Vertebrogenic pain is simply put, it's arthritis of the anterior portion of the spine where the discs are. So it's arthritis of the disc in the spine. And
is that typically what's wrong? Like people are feeling some kind of arthritic issue, or is it like a slipped disc, or what do you?
Well, the majority of back pain starts with degeneration of the disc.
I see.
So when you start to have degeneration of the disc, you start to have degeneration of the facet joints. The discs are in the front part of the spine, the facets are in the back part of the spine, and so you know, patients can also have radicular pain, which is sciatica, which goes down the leg to the foot.
Sure.
So there's different types of back pain, and there's different treatments for it. What we're going to talk about today is specifically about the arthritis in the disc area.
Yeah, so then let's get right to it. Intracept procedure, what is that exactly?
The Intracept procedure is really an ablation type procedure, a radiofrequency ablation, an RFA. Many people have heard of that for the back of the spine where the facets are, but there's new technology that now we can do an ablation for the vertebrogenic pain or the disc arthritis.
Okay, so we just to simplify it in very simple terms. So when you first go in, you do the ablation on the front end. A lot of times that takes care of things, and then sometimes you go to the back end and work on the back side of the spine. So break it down for me.
Yeah, so arthritis doesn't happen in a vacuum. It happens over time, and it happens kind of all over the spine. So many people, for a very long time, we've been treating arthritis in the facets for a long time with radiofrequency ablation. It's been very successful, but there's a lot of people that the ablation doesn't last as long as we thought or doesn't work as well as we thought. And the reason, probably the most likely reason that's happening is because they also have symptoms coming from the disc.
I see. And Dr. Church, the procedures that you engage in or that you help people with, do they block the nerve so we don't feel the pain, or, you know, again, very simple terms.
Yeah.
I'm not a doctor like you, but how would you break that down? How does it work?
I think the simplest way to think about an ablation is that we do a treatment on a nerve where the signal of the pain signal from the disc or the facet joint is blocked from going to the brain. So your brain doesn't sense the pain, so then you don't feel the pain like you would if you didn't have the ablation.
Got it. If people at home are suffering right now, who would you say would be the ideal candidate to come find help with you?
Well, everybody develops arthritis in their spine at some point in their life.
Okay.
Not everybody is symptomatic. So patients that have back pain with prolonged sitting, they have back pain when they get up, they have back pain when they stand, they're definitely a candidate for evaluation to see if they're a candidate for this procedure or other procedures.
There's so many different causes for back pain, right? It's not just a one-size-fits-all when it comes to treating back pain.
Yeah, everybody has a different life experience and experiences that they've been through. So some people will have more back pain than others, and it just really depends.
Okay, and it could be age, it could be a car accident, it could be you just carry a lot of maybe heavy equipment in your job or something.
Absolutely, we have people that tell us that their back pain started when they were a teenager. We have people that tell us their back pain started after they were doing some heavy lifting at the gym, car accident, like you mentioned.
Very good. Well, fascinating conversation. Dr. Church, thanks for spending some time with us on Your Life Arizona. Really appreciate your time.
Well, thank you.
If you want more information about Arizona Pain, you can check out their website. It's right there online, or you can call the number on your screen.